Maryland's first confirmed measles case this year has health leaders warning us to stay vigilant. The State Department of Health says this case is not related to the outbreaks in the Southwest. Howard County community reporter Dennis Valera followed up on this, and he joins us in studio. And Dennis, what do we know about the person who contracted measles?
Nikki, the State Department of Health still has not released any identifying information other than that they are a Howard County resident and that they did recently travel internationally. Now, Howard County Public Schools also sent out a note to families today saying it has not heard if this person is a student or a staff member. I talked to a pediatrician in our area. She's telling parents not to panic, but to vaccinate their children if they have not.
With a positive measles case now in Maryland, parents especially have been worried about the impact.
I do know some families who do not have their kids vaccinated, and it does worry me a little bit. We want our kids to be happy and healthy.
Infants are among the most vulnerable, since the first dose of a measles, mumps, and rubella, or MMR vaccine, typically isn't administered to children until they're 1 year of age. The second is given when they're 4.
It's one of the most contagious bugs that we have out there, okay?
Dr. Teresa Nguyen is the chair of pediatrics at Greater Baltimore Medical Center. She says one of the key symptoms is a rash starting from the head, spreading to the rest of the body. Measles can lead to pneumonia, even encephalitis, which can turn deadly. Symptoms can show up to 14 days after exposure.
The virus lives in the air for 2 hours after the person passes through, and 95% of people who are exposed, who are unvaccinated, will get the disease.
The infected patient recently traveled internationally, coming through Washington Dulles International and the Johns Hopkins Howard County Medical Center Pediatric Emergency Department. Children at least 6 months old traveling internationally can get an MMR vaccine dose early.
But I want to emphasize to parents that after your baby comes back to the States, we want to redo that immunization at a year of age.
CDC data shows more than 96% of Maryland students last school year are fully vaccinated against measles, higher than what's required for herd immunity. But even so, Dr. Nguyen is worried about more cases because there are pockets of under-vaccinated populations in the state. She's urging every parent to get their kids vaccinated.
We have a vaccine preventable illness here. Vaccines do save lives.
Now, others who are most vulnerable to measles are pregnant people and the immunocompromised. Other symptoms, as well as a more detailed account of where the measles patient was, will be on our website, WJZ.com. Back to you.